So hi everyone, we are now in the last topic, which is the health and safety. So we have three safety tips to avoid injuries. We have the safety and injury prevention, the handling incidents and illnesses, and lastly is the effects of substance abuse on performance and behavior. So now let us start and discuss first the safety and injury prevention. So stay tuned.
Health and safety. Safety and injury prevention. So we have here key tips for injury prevention. First, we have talk to your doctor. Don't start any exercise program without first checking with your primary care provider. Your doctor can determine whether you're healthy enough to exercise and if any modifications you'll need to make to your program. Next, choose your workout carefully. High-impact exercise programs aren't ideal for women with conditions like arthritis or osteoporosis. Non-impact exercise, including swimming or using an elliptical exercise machine, will give you aerobic conditioning without stressing your joints. Next, learn the proper techniques. So don't start any new exercise without first learning the correct form, and to learn the right form, work with a trainer at home or in the gym, or consult a physical therapist to help you tailor a workout to your health, conditions, and physical capabilities. Next, take care after activity. So after any sport or activity, be sure to encourage yourself to cool down, stretch out, and take care of any injuries, no matter how minor they may seem. Taking care after activity can help muscles recover faster and can help improve range of motion and flexibility. Next, we have get the right gear. Buy a pair of sturdy, comfortable sneakers that provide good arch support and have a cushioned heel to absorb shock. Wear loose and comfortable clothing that gives you room to move and breathe. Next, start gradually. So start slowly and build up gradually. Give yourself plenty of time to warm up and cool down with easy walking or gentle stretching, then speed up to a pace you can continue for 5 to 10 minutes without getting overly tired. Because as your stamina improves, gradually increase the amount of time you exercise. Then, the warm-up. Cold muscles are more injury prone, so a proper warm-up can improve blood flow to the working muscle and reduce stiffness, potentially lowering the risk of injury. Next, we have stay hydrated. Of course, when you work out, you sweat, and that means you lose some of the essential fluids your body needs to take you to your exercise program, and try to drink a glass of water before you exercise. And then take a few sips of water every 15 minutes throughout your routine. Cool down. So finish your workout with a slow walk or gentle stretch for 5 or 10 minutes to cool down and maintain flexibility. Vary your workouts. Say for example, even if you love yoga, alternate it with other programs such as dancing, tennis, or water aerobics. The variety will work different muscle groups, prevent boredom, and give your body a chance to recover between sessions. Next, we have know when to stop. You never want to work out to the point of pain. If an activity hurts, stop doing it right away. Remember to seek the advice of a medical professional whenever pain seems abnormal or is not improving. Get help immediately if you suddenly feel dizziness, shortness of breath, or chest pain. Then, get some rest and always have fun. Getting involved in sports and recreational activities is a great idea, but overdoing it can cause overuse injuries. Remember that activities should always be fun, and be sure that you get plenty of time to rest and rejuvenate.
Warm up and cool down exercise. Warm up exercise. A warm-up is usually performed before participating in technical sports or exercising. It generally consists of gradual increase and intensity in physical activity, a joint mobility exercise, and a stretching and a sport-related activity. So basically, it is important to do some warm-up exercise before we do our activity because it increases the body's muscle temperature to make the muscles loose, supple, and pliable. It also prepares the muscles, tendons, and joints for more strenuous activity and reduce the risk of injury. So an example of warm-up exercise, we have jumping jacks, hip rotations, push-ups, walking jacks, and etc. Next, we have cool down exercise, the act or an instance of allowing physiological activity to return to normal gradually after strenuous exercise by engaging in less strenuous exercise. An easy exercise done after a more intense activity to allow the body to gradually transition to a resting or near resting state. So, cool down exercise is also important after we finished our activity because it promotes recovery and return the body to a pre-exercise or pre-workout level. It also helps with the post-exercise muscle soreness that is usually experienced the day after a tough workout and helps and keeping the blood circulating and prevent blood pooling and remove waste products from the muscles. An example of cool down exercise are shoulder stretch, forward bend, overhead stretch, and etc.
Next, we have the harmful exercise that we shouldn't do or apply to avoid injury. First, we have the straight leg sit-ups. So there are several risks associated with this exercise. By keeping the legs straight, the individual exercise the hip flexors as well as the abdominals. When the hip flexors contract, they tend to cause a hyperextension or the lower back and a forward tilt of the pelvis. Therefore, the hip flexors are primarily strengthened and the abdominals remain relatively weak. In addition, this exercise puts excessive pressure on the lower back. Next, we have standing straight leg toe touch. Although toe touching is performed as a hamstring stretch, it is relatively ineffective and places undue strain on the spine and lower back muscles. In general, it is wise to avoid positions that require maintaining a bent forward position when standing. Next, we have head circles. Head circles, rolling the head or neck around in circles, puts undue stress on the uppermost part of the spine in the neck, particularly if this movement is done quickly and or forcefully. Neck hyperextensions can cause compression of the nerve roots in the neck and are especially risky for those individuals who already have degenerative disc disease. Next, we have hurdler's stretch. So this exercise is performed sitting on the floor with both legs apart and one leg tucked behind and outward while the individual reaches forward to touch the toe of the extended leg. This exercise places a great deal of stress on the ligaments in the knee joint of the bent leg. Last, we have the full squat. The full squat or the duck walk also places a tremendous amount of pressure on the knees. Not only is this exercise ineffective, the knee ligaments and cartilage are placed in an extremely vulnerable position. Exercising safely means avoiding potentially dangerous exercise and choosing exercise that are appropriate for one's level of fitness. Ensuring proper technique is critical, and an exercise routine should be started at an appropriate slow pace, taking care not to increase the level of difficulty and intensity too rapidly. Next, we have handling accidents and illnesses. Some injuries can be treated with basic first aid techniques such as wound cleansing, wound dressing, rest, application of ice, comprehension, and elevation. More severe injuries may require cardiopulmonary resuscitation or the CPR and other resuscitation procedures or surgery. So we have here the eight most common injuries. Next, we have handling accidents and illnesses. Some injuries can be treated with basic first aid techniques such as wound cleansing, wound dressings, rest, application of ice, comprehension, and elevation. More severe injuries may require cardiopulmonary resuscitation, the CPR, and the other resuscitation procedures or surgery. So we have here the 8 most common injuries requiring first aid. First, we have cut or scrape. If there is bleeding, press firmly over the site with a clean cloth until it stops, anywhere from 3 to 15 minutes. And in addition to that, clean it with lukewarm running water and gently pat. If the skin is broken, apply a thin layer of antibiotic ointment, then cover with a bandage or an adhesive tape. Next, we have burn. Immediately hold injury under cold running water or apply a cold, wet towel until the pain subsides. Next, splinter. Use soap and water to wash around the splinter because it will help you to remove immediately and rub it with alcohol and slowly pull the splinter out. Rewash the skin, and if you come across a fragrance that is hard to remove, leave it for a day or to see if it will come out on its own. Then next, we have insect bite or sting. If the insect left a stinger, gently scrape the skin with your fingernail to remove it without breaking it. Next, we have sunburn, reddening, inflammation, and in severe cases, blistering and peeling of the skin caused by overexposure to the ultraviolet rays of the sun. So, to avoid from peeling of the skin, must apply cold compresses and aloe vera lotion and take some ibuprofen. Avoid creams with petroleum which can cause infection. Next is nosebleed. Sit down and firmly pinch the soft part of your nose. So we must make sure to pinch the soft part of the nose against the hard bony ridge that forms the bridge of the nose. Squeezing at or above the bony part of the nose will not pressure where it can help stop the bleeding. Next, we have sprain, strains, and tears. These injuries are similar but involve different types of body tissue. So, when a sprain, strain, or tear takes place, the first thing to do is immobilize the affected area, elevate it, and apply ice compression to reduce swelling. Strains accompanied by severe pain. Swelling or discoloration may require a trip to the hospital. In milder cases, rest, ice, and anti-inflammatory medication will help the area heal. Then lastly, we have fractures. Fractures are broken bones, and they can occur as a result of falls or other harsh impacts. So when this happens, the affected part should be immobilized, and additional manipulation of the affected area should be avoided. Remember that a fracture could sever a blood vessel or a nerve if it is not immobilized, resulting in a much more severe injury. Immobilize the injured part and transport the patient to the nearest hospital or medical clinic as soon as possible. Therefore, everyone needs a well-stocked first aid kit at home and on the go. Accidents can happen anywhere, and it is beneficial always to be prepared. When is CPR helpful? People can need CPR for many different emergencies, including near drowning, heart attacks, smoke inhalation, drug overdose, accidents, sudden infant death syndrome or the SIDS, drug overdoses, and suffocation. So, I conclude that these accidents or emergencies requires the use of CPR or the cardiopulmonary resuscitation. It is an emergency life-saving procedure that is performed when the heart stops beating or the blood flow to the heart is blocked and can cause a heart attack problem, and these emergencies also need chest compressions that can help the flow of blood to the heart, brain, and other organs. CPR begins with 30 chest compressions, followed by 2 rescue breaths. According to the American Heart Association, rescuers doing comprehensions should push hard, fast, and in the center of the chest. Then, the airway. When you perform CPR, you must check the airway and perform 30 compressions. Check the person's airway to make sure it is open for breathing. The airway may be blocked by the tongue when someone loses consciousness or by food or another foreign object. And last is the breathing. Rescue breathing starts after the 30 compressions when the airway is open. Someone doing rescue breathing breaths for the victim by forcing air into the lungs. This includes breathing into the victim's mouth at the right times and checking for signs of life. So, we should know how and when to do CPR. Done correctly, CPR can save a person's life. It brings blood to the heart, brain, and other organs and starts breathing until healthcare providers can give the person advanced life support. So, if you aren't healthy, your body won't move like it should, and your risk of injury will increase drastically. With that in mind, these 5 safety and wellness tips are key to keeping you safe in the water. So 5 steps to prevent swimming injury. First, we have warm up first. Warming up your muscles, joints, and ligaments helps your body to get ready to work out. Athletes who don't start with a warm-up program have a higher risk of injury than those who do. Your coach, trainer, or doctor can give you tips on which exercises and stretches are best for the type of swimming you do. Next, use proper techniques. In any sport, proper technique serves 2 important purposes. The first is to make sure that you are working as efficiently as possible for your particular event. The second is keeping you safe. Using proper technique is key to swimming injury prevention. Have your coach or trainer or your personal trainer at your gym watch you swim a few laps of each stroke to get a feel for your style, and then correct any mechanical errors that may put you at risk for joint and muscle problems. Next, work out all your muscles group. So don't just train the muscles you think you'll use in the water. Each part of your body works together as a whole when you're swimming. So keeping your whole body fit is an important factor or swimming injury prevention. If you are able to do weight training exercises a few days a week, focusing on getting all your muscle groups ready to swim. Next, be aware of your surroundings. If you're swimming in a pool, make sure you can see when you're coming to a wall and that you know where other swimmers in your lane are. if you are swimming in a lake or ocean with low visibility, take your time and be extra careful of other swimmers and obstacles. The more people are in your vicinity, the greater your risk for injury, meaning that synchronized swimmers are particularly high risk and need to be alert all the time. Lastly, don't swim if you're not healthy. If you have a fever, are particularly hot or cold, or just don't feel well, don't swim. An athlete who isn't in physically tip-top shape is a danger to himself or herself and others in the water. Take the time you need to rest and recover from any illness or injury before suiting up and diving in. So swimming injury prevention is the primary job of every athlete, coach, and trainer. So even if you don't swim competitively, taking care of your body has to come first. And the last topic we have, the effects of substance abuse on performance and behavior. So what is substance abuse? Substance abuse, also known as drug abuse, is use of a drug in amounts or by methods which are harmful to the individual or others. It also refers to the use of psychoactive substance, including alcohol and illicit drugs. So substance abuse differs from addiction. Many people with substance abuse problems are able to quit or can change their unhealthy behavior. Addiction, on the other hand, is a disease. It means you can stop using even when your condition causes you harm. It should come as no surprise that drugs and alcohol can have negative effects on our life. Although sometimes it may be difficult to imagine, the abuse of these substances can change everything from your body to your bank account. So, these harmful effects of drugs and alcohol, this can conclude anything from the first we have brain chemistry. The human brain is the most complex organ in the body, although it may weigh less than 3 pounds. It somewhat mysteriously controls both your thoughts and the physiological processes that keep you alive. Drugs and alcohol change the way you feel by altering the chemicals that keep your brain working smoothly. Next, health complications. Drug and alcohol use impacts nearly every part of your body from your heart to your bowels. Substance abuse can lead to abnormal heart rates and heart attacks, and injecting drugs can result in collapsed veins and infections in your heart valves. Some drugs can also stop your bones from growing properly, while others result in severe muscle cramping and general weaknesses. Using drugs over a long period of time will also eventually damage your kidneys and your liver. Next, infections. When you are under the influence of drugs or alcohol, you might forget to engage in safe sex practices. Having unprotected sex increases your chances of contracting a sexually transmitted disease. Sharing the needles used to inject certain drugs can give you diseases like hepatitis C, hepatitis B, and HIV. You can also spread common colds, the flu, and mono from sharing pipes. Then the legal consequences. Drug and alcohol abuse not only has negative effects on your health, but can also have legal consequences that you'll have to deal with for the rest of your life. Many employers require that you take a drug test before offering you a job. Many of them even conduct random drug tests even after you become an employee. Refusing to give up drugs could end up making you unemployed, which comes with even more issues. Driving under the influence of drugs or alcohol can lead to a suspended driver's license, usually for 6 months to 2 years. You'll also need to pay heavy fines and may even spend some time in jail. Next, the financial problems. Drugs and alcohol are expensive, especially when you're using a lot and constantly. Substance abuse also impacts your productivity and success at work and in school. The time spent searching for, using, and recuperating from drugs can be better spent learning new skills to advance your career. The legal issues tied to drug use will increase your bills as well. Your car and health insurance rates may increase and you will have to find a way to pay for arrest warrants and legal counsel. Lastly, the injuries and death. If you use drugs and alcohol, you're more likely to experience physical injury or be involved in car accidents. Even worse, you also have an increased risk of death through both suicide and homicide. So, substance abuse affects every part of our life. It can hurt you and the people around you. It can ruin relationships and your financial health. Abusing drugs can also lead to addiction and cause serious health problems and even death. So to stop, you may need counseling, medicine, or both. If you have a substance abuse problem and want to quit, a doctor can help figure out the best treatment options for you.
Okay, so to sum up everything, we can't deny the fact that getting involved in sports and recreational activities is a great idea for us. But also, it is very important for us to know the different safety precautions and use the safety equipments to avoid injuries. And also, being aware of our health, we must seek first or consult your doctor if you have health issues so that you are guided in what particular activity or sport that you must do and avoid. We all know that our health is very important because being healthy means being mentally and emotionally fit, and also living a healthy lifestyle can help prevent chronic diseases and long-term illnesses. So if you have a good health, then you are confident enough and without any hesitations to do heavy workouts or activities that you want to do or try. And also remember that if you have poor health, then habits can add stress to your life and also play a role in how well you are able to cope up with stress. The stress that comes from your health is significant, so we must keep our body healthy and strong. Thank you.